Roughly about 10 days ago, there was a 40-year-old lady who came to the hospital with sudden onset pain abdomen. We evaluated her. She had vomiting as well. On examination, we found that the abdomen was totally distended and she was not passing gas or motions down. Now we found that she had acute onset of intestinal obstruction. So she underwent a thorough evaluation, diagnostics, and we found out that her intestine was completely blocked. Whatever she was eating, she was not digesting, and she was continuously vomiting and had pain because of the same. She underwent surgery the same day, and we found that there was a block in the intestine, which was because of a cancerous growth in the small intestine. So I had to remove part of the intestine and then rejoin it. 3-4 days later, she walked home without any problem. Now that is just one case of a surgical emergency that we have encountered here in People Tree at Meenakshi, Bangalore. Hello, I am Dr. Manoj Karthik, who is the Surgeon-in-Chief of People Tree Hospitals at Meenakshi. Welcome you all. Hope you are doing all fine. Now, surgical emergencies are a broad specialties. We are available here 24/7 to cater to any of the emergencies that an individual can come across throughout the lifetime, right from birth till the decades, till about 90, 100 or whatever the age may be. We have tackled quite a few problems across age groups, across severities and across chronicities. Now, most of the cases have presented in the middle of the night, wherein the surgical specialists are not so available commonly, or not available commonly even in a tier 1 city like Bangalore. We are open 24/7 for emergencies, and we have catered to the population in need at the time of need. Any patient who has come seeking emergency care here has been attended within 15 minutes to 30 minutes by the specialist who is the person in charge for that patient. The commonest cause a patient comes to the casualty with the surgical emergency is by and large the infection in the appendix. And the second commonest cause, especially in a middle-aged or an elderly lady, is stones in the gallbladder, which secondarily infects the mucus or the bile inside the gallbladder. That's called cholecystitis. Both of which are successfully treated by emergency laparoscopic surgeries and minimally invasive surgeries. Not so technically challenging, but then timing is of most importance. Timing is the priority in such scenarios, and we have to act and operate before it ruptures or before it perforates into the peritoneal cavity. We have catered to quite a few patients with such conditions. We have operated even in the middle of the nights in patients with such conditions, and all of them have walked home in a couple of days and have always kept us in high regard. As a surgical department, as the team of surgeons here, and we have also catered to cancers in different parts of the body, thyroid, breast, or even lumps and bumps in the abdomen, in the skin, and so on and so forth. Each case is tackled individually, is examined individually, and there's no one-step approach or one-size-fits-all. We are in the age of individualized medicine, and then that's what our guiding principle is. We don't stick to the priorities or formulas. What is best for that patient among the options that are scientifically available, that's what we tell the patients. And of course, everything is done after the consent with the agreement of the patient in the best interest of the patient. Thank you very much. I'm Dr. Manoj signing off. Hope we don't meet again as a patient and a doctor. Thank you.